Welcome back to our Riverside Chats. Today we have a special guest joining us, one Hayley Jelinek, a health educator here at Two Rivers. Hi, Hayley.
Hello.
So May is Mental Health Awareness Month, and we've talked about the history of mental health care. We've talked about PTSD, what it looks like, and we've also talked about the physical aspects of mental health. What do you want people to know about mental health as a health educator?
You know, there's so much. I guess what I really want to talk about is, there's a lot of different things that we can do to manage our mental health. One of the biggest things that I'm going to say is if they get the right meds, you're going to feel better. And then you're going to say, oh, I feel better. So I don't want to take the medicine anymore.
Right, but that's not how medication works.
No. You quit taking the medication, and then you feel yucky again, and the whole cycle starts over. So something that it's important to me, I know that for the rest of my life, I'm going to be taking antidepressants. And I had to figure out emotionally how to make that okay with me. And now I know if I miss a dose, I'm bawling or yelling, and that is definitely not what I want for my family or my work family. So that is one of the most important things, if you ask me.
Earlier this month, we talked about the physiology of mental illness, but there's more to that than just the biological causes. Like you said, your family has it. It's a genetic thing. It does run in families. But what else can contribute to mental illness?
What's going on in your day-to-day life?
So situationally.
Yes. If something is very stressful or traumatic, it can block your emotions up. And it's almost like you're stuck. There's also social issues that can be going on that can bother you. Stuff that's going on at your home, in your community, relationship issues with your parents, a loved one, your coworkers, that all kind of plays into it. So it's a lot of things, everyday things that affects your mental health, and that's what stings because it's just your day-to-day life.
What are some trends we're seeing currently?
Kids ages 6 to 17 are like 3 times more likely to have to repeat a grade because of their mental or emotional developmental behavior issues. A lot of times there are adults and kids with mental illness that use a lot of substances. There's a lot of substance misuse going on.
Why do you think mental health in the United States specifically is so prevalent?
Number one, I think mental health issues have been around since the beginning of time. But everybody just kind of thought, oh, that's just a quirk that so-and-so had. So I think it's being noticed a lot more.
Well, a lot of it has a name now.
Exactly.
Do you think that part of the reason the United States has a prevalent mental health issue is because there's not enough professionals to help with it?
Yes. And I know Nebraska is one of the states that we are so behind on how many mental health providers should be in our state. It's ridiculous. I mean, I wish I could give you a statistic on that. And I know I've talked to you about it in the past, but that's huge.
The health department, Two Rivers Public Health Department, has a mental health resource. Tell me about it.
Incredible money. It is an awesome website. You could go on there and take quizzes, and it'll say, there's a possibility you're getting depressed and you should go talk to your family physician. Or the other thing about it is it's not just for mental health either. It's for other stuff like, what do I need to do to move into my dorm? Whoa, what can I do to learn how to be an adult more? Go right on our website and you can find it. It's wonderful. It's not to take place of a doctor or a therapist.
Right.
But it'll point you in the right direction sometimes. And I think sometimes we just need a little of that.
Thanks for joining me today, and stay happy and healthy, everyone. Until next time.